Now, MUMPS is actually a viral infection, and when children get MUMPS, they usually complain that it hurts when they open their mouths, and it's usually at the jaw of their mouth. The reason that MUMPS is a big deal is because it can also cause inflammation of the testicles.
Hello everyone, welcome back to Pediatrics To-Go. Today we're talking about MUMPS in children, and I'm Francisca, your co-host, and we have Dr. Sanusi here, your trusted pediatrician. So on to you, Dr. Sanusi.
Thank you, Francisca. Hello everyone. We're going to be talking about MUMPS today, and the reason is it's a totally preventable illness. A lot of people get the measles vaccine, but I'm not sure if a lot of people get the mumps, measles, rubella vaccine. Now, MUMPS is actually a viral infection, and when children get MUMPS, they usually complain that it hurts when they open their mouths, and it's usually at the jaw of their mouth. Now, we do have salivary glands, and the salivary glands we have on the cheek is where the MUMPS virus likes to be. When children get the MUMPS infection, they could have a fever first, they could have a prodrome with a cold, runny nose, and then they start to complain and cry when they eat anything because it hurts. And whenever we eat, we have the salivary gland here, which is called the parotid gland. That is the salivary gland that the MUMPS virus likes to stay in. So many children will come in and their cheeks are swollen and they don't want to open their mouth because of the pain. And there's usually a history where we ask them, okay, based on your vaccine, we look at the vaccine records, and there usually is no MMR vaccine in their records, because children who have had the mumps, measles, rubella vaccine have been vaccinated against the mumps, and they don't end up with the mumps infection. Now, when children end up having the mumps virus, especially when there's no history of vaccination, what is the treatment? We just recommend that they eat a lot of sour candy or candy, yes, and hard candy. That helps to increase the salivary gland flow. So as they increase the salivary gland flow, they're actually excreting the virus from inside the salivary gland. And then they end up swallowing it. They swallow it, and then they drink a lot. They pee out the infection in their urine, sometimes in the stool too. So we recommend eating a lot of hard candy or anything that's hard, like Tum-Tum that they can suck on if they're old enough. If they're young children, you don't want to give them any of that. Just make sure they're drinking a lot, and that will also help to flush the virus out of their system. So we tell parents, give ibuprofen for pain. If they have a fever, same thing, ibuprofen or Tylenol or paracetamol or Panadol. You go ahead and give that to them on every 6 to 8 hours for comfort. Make sure that they're just comfortable where they are. And usually it goes away in about 7 to 10 days. Now, if a child is exposed to mumps today, it takes an average of a couple of days, sometimes 3 to 4 days for the child to start having symptoms. But as long as, once they have symptoms, you want to make sure that you treat the symptoms, and within 7 to 10 days, most children are better. The reason that mumps is a big deal is because it can also cause inflammation of the testicles. That's what we call mumpsitis. So if it's an illness that a vaccine can prevent, we recommend moms, dads, go ahead and get your child the MMR vaccine. It's 2 vaccines. You give the first MMR at age 1, and give the second MMR at age 4, which is like a booster dose. And that way your children won't get mumps, and you don't have to worry about them getting inflammation of their testicles, which in future can cause infertility. So that's why we recommend it. But it's a mild illness generally, apart from if it affects the testicles. And most children, when they get it, they get better and they're fine. So it's not something we worry about, but get your child vaccinated just because of side effects long term, especially if they get the inflammation of the testicles.
Oh, so that means mumps only occurs in boys?
Yes, orchitis occurs, it occurs in girls and boys, but the side effects, if it's in a boy, they can end up having inflammation of the testicles, which can be painful. Most children don't get it, but the rare children that get it, it's not a necessary thing if you can get the vaccine. But when they get it, they're fine. It's just that we have to treat with painkillers to make sure that goes away sooner than later, and it's not uncomfortable for them.
All right. Okay. All right. Okay. Thank you very much for keeping up with us. So until next time on Pediatrics To Go. All right. Bye.
Bye.